Assalamualaikum warahmatullahi wabarakatuh. We are from Group 2 and we are going to present about the approaches taken by the government in handling the COVID-19 pandemic in all sectors.
The world has been shocked by an outbreak that occurred in Wuhan, China, namely the coronavirus outbreak. The spread of the virus has spread beyond and has crossed the borders of India, Brazil and the United States, reported as among the high countries number according to the COVID-19 case scale. Cases in the US are 86,637,487 cases, while in India there are 43,185,049 cases. Moreover, many countries are still struggling to find effective methods to ensure that every infection received can reduce the implication of life among the people. As a result, the death cases that plague the whole world are increased and affecting human beings a lot in various aspects. The majority of those affected with the virus will experience mild to moderate respiratory symptoms and will recover without the need for special treatment. Meanwhile, some people will become unwell and need medical treatment. For example, the elderly, as well as individuals with underlying medical illnesses, including cardiovascular disease, diabetes, chronic lung disease, or cancer, are at high risk for developing serious illnesses. COVID-19 can make anyone sick and cause them to become very ill or die at any age. Among the symptoms that can be experienced in COVID-19 patients are fever, cold, lack or sense of smell and fatigue. In Malaysia, according to the statistics of June 6, 2022, there were 1330 new cases, bringing the total number of COVID-19 confirmed cases to 2,614,418, followed by 30,240 deaths. Therefore, the Prime Minister of Malaysia, Tan Sri Muhyiddin Yassin, has declared a Movement Control Order (MCO) from March 18 to March 31, 2020 to close all activities involving public gatherings in all religious, sport and cultural activities. This is because it reduces the spread of the virus from carrier to receiver. As a result, COVID-19 transmission has changed the physiology of Malaysians, causing behavioral changes such as panic buying, disrespect, overspending and stress. Apart from that, the Prime Minister also instructed all members of the police and army to control, impose action and enforce prohibition orders to prevent the people who still do not understand about dangerous disease.
My name is AFRINA binti NASARUDDIN. My ID number is 2020-846306. Now I am going to present about the approaches by government in health sector. The COVID-19 outbreak served as a stark reminder that we live in a world that is both complicated and unexpected. Effective responses to the pandemic have necessitated changes from traditional procedures. healthcare executives have a chance to better position and adapt their organizations for an uncertain future. The first approaches in health sector are the collaboration with private hospitals. Malaysia's Ministry of Health has allocated 49 million ringgit for 3764 surgery or procedures in 19 clinic disciplines. MOH has no obstacles but welcomes private hospitals to treat COVID-19 patients. The initiative involved 23 MOH hospitals and 31 private hospitals. Next, they collaborate with private labs. Private labs also play an important role in conducting tests for MOH. MOH has 6 labs at the beginning of the pandemic with capacity 832 tests per day. Moreover, COVID-19 screening in private facilities including private medical clinics. Private medical clinics are also allowed to provide on-site health screening booth services in place other than in a factory, public hall, or office building. Private medical labs are not involved in the sample recruitment process and are only testing on the sample received. For facilities that do not have such facilities, samples will be sent to a private medical laboratory. Last but not least, assistance for medical and labor resources from the private health sector. The Ministry of Health appreciates the help provided by the public sector in dealing with this pandemic. The private health sector also plays an important role in providing medical and labor resources for MOH work to protect against this particular strain of this coronavirus.
Assalamualaikum warahmatullahi wabarakatuh. My name is NATASHA. My metric number is 2020-883336 and I'm going to present about the approaches by government in managing pandemic COVID-19 in safety sector. The COVID-19 outbreak spread in Malaysia on 25 January 2020 after one of the tourists from Malaysia who entered Malaysia from Singapore was suspected of having an outbreak of the disease. The government has made a various effort to address this issue. To ensure safety of the people during the spread of COVID-19, the Prime Minister announced the Movement Control Order (MCO) at an early stage. The government has introduced several types of Movement Control Order, such as Movement Control Order (MCO), Conditional Movement Control Order (CMCO), Recovery Movement Control Order (RMCO), Enhanced Movement Control Order (EMCO), Targeted Enhanced Movement Control Order (TEMCO), and Administrative Enhanced Movement Control Order (AEMCO). The MCO was implemented from March 18 to May 3, 2020. Its objective was to break the COVID-19 link. To achieve this, the official had to limit physical and social contact. The CMCO was implemented from May 4 to June 9, 2020. Its main objective was to reopen the country economy and put it back on track. As its name suggests, the order allowed most economic sectors to operate. However, the public movement was restricted. The Road Maintenance and Coordination (RMCO) program was implemented from June 10 to December 31, 2020. Its aim to reopen the country economy and social sector gradually. All sectors are allowed to operate and strict measures are being implemented to ensure the public safety. The EMCO program implementation is considered to the most challenging movement control order. It involves restricting individuals and group activity in areas identified as high risk. Another type of movement control order is the TEMCO, which targets smaller spaces and places. This type of movement control order applies to building and residential complex. Finally, another type of movement control order that target high-risk area is the AEMCO. It allows residents to travel within and outside the affected region, but it has fewer restrictions. Last but not least, in ensuring that people comply with the provision of SOP, the government has issued a law that individuals found violating the requirement of the SOP can be fined a maximum of 1,000 ringgit under the Prevention of and Control of Infectious Diseases Act 1988.
Assalamualaikum warahmatullahi wabarakatuh. My name is AQILAH UMAIRAH binti SHAHARUDIN. My ID number is 2020-894566 and I'm going to present about government approaches in managing COVID-19 in education sector. On 18 March 2020, Prime Minister of Malaysia implemented Movement Control Order. It was announced on 16 March 2020, which was 2 days before the implementation of the MCO. Education Ministry advised that all education sectors to postpone their activities due to the pandemic and MCO. However, the government wanted the higher education system able to work continuously without any interruption. The government announced that higher education, which is universities, to do online distance learning. The students need to continue their studies despite what's happening around the world. This type of learning does not require students to physically attend the class. This is the approaches of government in handling the COVID-19 from spread. No one is allowed to meet each other face-to-face, including the lecturers. Government want the higher education system to operate without any interruption because they do not want Malaysian students left behind with another student from another countries. This initiative requires the power of the internet to continue. We cannot deny that there are students live in low internet access area. The government and the Malaysian Communication and Multimedia Commission (MCMC) were doing their best to solve the problem faced by the students who live in the area. Therefore, MCMC provides the devices and services to the community. MCMC also advised and instructed the service providers to improve their internet quality in such areas. Moreover, the government implemented an initiative to donate 150,000 laptops to B40 students who cannot afford to buy a laptop. This is the initiative from the government in helping those who cannot afford to buy the devices for ODL. Other than that, Government of Malaysia provides and subsidies 1 GB data daily for the citizens. Despite the government provides free 1 GB data, some students still cannot access to the internet due to the geographical area. MCMC play its roles in advising and instructing the service providers to improve their internet quality in such areas.
Assalamualaikum. Hi, my name is Fiqry bin ROZAFUZAN. My matrix number is 2020832862. And I am going to present about how government handling the COVID-19 pandemic in social welfare sector. Firstly, our government addressed the issue of social welfare through Social Welfare Department. Many initiatives was taken by Social Welfare Department in helping those who are affected during COVID-19. As we can see, our government are really committed, wanted to continue to strengthen the role of the Social Welfare Department and all its employees through the implementation of various initiatives and improvement efforts. The efforts made by the government through the Ministry of Women, Family and Community Development aims to ensure the delivery of efficient and people-friendly welfare assistance services. This is proven by the distribution of the budget allocated for the welfare of society in increasing year by year has shown that the government places the great emphasis on ensuring the welfare of the community continues to be channeled. Second approach taken by the government is by introducing economic stimulus package. Our government is aware that in this difficult situation, the people rely on the concern of the government to help ease their burden and ensuring their survival. The People's Concern Agenda is one of the main focus and thrust of the government to help Malaysians, especially the B40 and M40 income groups, through several direct cash assistance measures. The initiatives implemented are important to ensure that all assistance can be channeled to the target group to help the people in the face of economic recovery and also to ensure that the lives and welfare of the people are always protected. Another point to show our government are really committed is through the National Annual Budget, which often places social welfare as the main point in the national budget presented by the government over the last 2 years during COVID-19 pandemic. Social welfare is a key aspect of the national budget to ensure that the people continue to be assisted with various initiatives to give them opportunities and space to rebuild their lives that were affected during the COVID-19 period. The initiatives that have been implemented by the government touch on all aspects involving all levels of Malaysian society. The allocation given by the government is intended to reduce the burden of Malaysians and ensure the continuity of the people's welfare is always defended. E-Belia and E-Pemula are among the programs that have been carried out in 2021 and 2022 under the national budget introduced by the government. Another approach taken by the government in handling social welfare issue is by allow special withdrawals from the Employees Provident Fund (EPF). The measures taken by the government are seen as a sign of the government's concern to alleviate the suffering of the people in covering household expenses. The permission was given after the government heard, studied and examined the request from all parties regarding the withdrawal of the retirement saving contribution. The initiative taken by the government is to help the current situation as well as to restore the economic cycle of the community affected and squeezed due to the effects of COVID-19 and the national economy. This special EPF withdrawal can help contributors in various aspects and at the same time can improve the country's economy again. Lastly, our government has introduced an initiative to create more employment opportunities for Malaysians to help those who have lost their job during pandemic. This initiative also can help in decreasing the unemployment rate in our country. The Job Guarantee 2022 initiative was introduced under the Malaysian family is focused on 3 main programs in an effort to create employment opportunities for Malaysians. It consists of 3 main components under the Job Guarantee 2022 initiative, which is the Job Guarantee Employment Incentive, the Malaysia Short-Term Employment Program, MyStep, and the Training and Skills Upgrading Program. These programs will create 600,000 jobs opportunities this year.
In conclusion, the COVID-19 epidemic has had a major impact on the rest of the world, both economically and socially. This will lead to an economic downturn and the number of unemployed will increase as no jobs can be done face to face. This is because the construction sector declined sharply due to lack of demand, while no new businesses were generated as they had to struggle to save existing companies from closing. In addition, the Ministry of Higher Education (MOHE) and public and private universities have issued the latest instructions to students for each semester using the online distance learning methods (ODL). The effect of the epidemic are also felt in sporting events such as the SUKMA 2020 Games, the ASEAN Squash Teams Championship and the 2000 Summer Olympics. This is because there is no specific therapy for COVID-19 at this time. Many clinical studies are underway around the world to develop drugs and vaccine for COVID-19. Apart from that, Malaysia also faces various challenges to ensure that the people are healthy and peaceful. However, the nature of patience and courage of the Malaysian government in dealing with the epidemic, with the resilience of Malaysian health system and the participation of the people can increase the chances of Malaysians struggle to fight the epidemic successfully.